Okay, I now call this meeting to order. The time is 8:32 a.m. and the Board of Physical Therapy is entering into public session. Uh, Michelle, could you please call the roll?
Yes, ma'am. Timothy,
Here.
Aaron,
Here.
Mariah,
Here.
Sandra,
Here.
Hoku,
Here.
Susan,
Here.
Erica,
Here.
Dwight.
Here.
For staff present, Michelle, Sherry,
Here.
Gayla,
Here.
Sarah,
Here.
Joanna.
Here.
And Madam Chair, for the record, we do have members of the public present. And next slide, I believe.
Okay. So uh, do I ask someone else to read this?
Yeah, at your discretion.
Okay, I will ask Dwight to read its statutory purpose.
To protect the public health, safety, and welfare for all Oregonians by maintaining standards for quality care, professional skill, and competence through the effective regulation of the practice of physical therapy.
Thank you.
And Madam Chair, for today, the first order of business would be, here's the agenda. And for the members of the public, there is a copy of these meeting materials that are available on the board's website on the meetings page, so that you can follow along at home. Otherwise, the first order of business would be board motions as a result of the prior executive session.
Okay.
Are you ready for motions?
Yeah, I'm ready for the motions. We're ready to begin.
In case number PT 914-07/25, I move to offer a settlement agreement for violations of ORS 688 period 140 parentheses 2 parentheses little a parentheses little s OAR 848 -040 -011110. So let me repeat that from the dash 0110 parentheses 1 parentheses 2 and OAR 848 -045 -0020 parentheses 2 parentheses little I, including a reprimand and requiring the completion of the Oregon Jurisprudence Assessment Module within 90 days.
I second the motion.
The motion's been first and seconded. Roll call vote. Timothy,
Aye.
Aaron,
Aye.
Mariah,
Aye.
Sandra,
Aye.
Hoku,
Aye.
Susan,
Aye.
Erica,
Aye.
Dwight.
Aye.
Madam Chair, the motion carries unanimously.
Okay, next motion.
In case number PT 916-08/25, I move to close the case.
I second the motion.
Motion's been first and seconded. Roll call vote. Timothy,
Aye.
Aaron,
Aye.
Mariah,
Aye.
Sandra,
Aye.
Hoku,
Aye.
Susan,
Aye.
Erica,
Aye.
Dwight.
Aye.
Madam Chair, the motion carries unanimously.
Okay, next motion, please.
In case number PT 780-10/22, I move to delegate authority to staff in terms of the probation.
I second the motion.
Motion has been first and seconded. Roll call vote. Timothy,
Aye.
Aaron,
Aye.
Mariah,
Aye.
Sandra,
Aye.
Hoku,
Aye.
Susan,
Aye.
Erica,
Aye.
Dwight.
Aye.
Madam Chair, that motion carries unanimously.
Next motion, please.
In case number PT 905-05/25, I move to issue a settlement agreement and final order.
I second the motion.
Motion has been first and seconded. Roll call vote. Timothy,
Aye.
Aaron,
Aye.
Mariah,
Aye.
Sandra,
Aye.
Hoku,
Aye.
Susan,
Aye.
Erica,
Aye.
Dwight.
Aye.
Madam Chair, the motion carries unanimously.
Thank you. Next motion, please.
I move to ratify the administrative closure of cases PT 919-09-25, PT 920-09/25, PT 921-09/25, PT 922-09/25, PT 929-10/25, PT 923-09/25.
I second the motion.
Motion's been first and seconded. Roll call vote. Timothy,
Aye.
Aaron,
Aye.
Mariah,
Aye.
Sandra,
Aye.
Hoku,
Aye.
Susan,
Aye.
Erica,
Aye.
Dwight.
Aye.
Madam Chair, the motion carries unanimously.
Thank you. Next motion, please.
Wait, um,
That was, oh, go ahead.
I was gonna say, I think there's one on there that, we missed.
Is there a motion for PT 933?
Yes. I missed that one. In case number PT 933-12/25, I move to close the case.
I second the motion.
Motion's been first and seconded. Roll call vote. Timothy,
Aye.
Aaron,
Aye.
Mariah,
Aye.
Sandra,
Aye.
Hoku,
Aye.
Susan,
Aye.
Erica,
Aye.
Dwight.
Aye.
Madam Chair, the motion carries unanimously.
Okay, thank you. Next motion.
That was the last motion.
Move on, and the next agenda item be the consent agenda.
For the consent agenda item, these are materials that are sent out to the board ahead of the meeting for review, including the minutes, the ratification report for licenses issued, and the director's report and financials. Sarah, if you could go to, I think, the last page of the director's report, so just before the detailed financials. Thank you. And if you could expand that page. Wanted to just highlight just a couple of things today. One, we had a lot of school visits, most of which are in person, which is great, where Sherry and Gayla do go out and spend time with the programs and with the students that are here, and a number of news briefs in this last period. Of course, we're going to intensify that. Most of those are going to be targeted at renewals, and we'll talk about that further. And then if you scroll just a bit more on the administrative highlights and the dashboard with regard to the agency statewide expectations, the last meeting, the succession plan was due. That was submitted and accepted by Department of DAS Human Resources. So as far as 2025, the board did meet all of the governor's expectations for submittals, and we'll be starting the process over as things become due mid-year with strategic plan, DEI, some of those other plans. And in other highlight, if you scroll just a bit more, please, a couple of updates here. The outside auditor, the review required by statute of the biennium is nearly complete, working with Baker Tilly. They have provided a draft report that does not appear to have any findings or recommendations for corrective action. That draft is expected to be finalized after they go through their final review and then submitted to the board. So you will have that available for the March review. And that document is also then incorporated into the legislative reporting that is due in April. The system stabilization, information technology, we are continuing to work with DAS. There is still an expected RFP that will go out that has not yet been released by DAS procurement, but we do expect that in the near future. And with those highlights, I'll stop and well, actually, I apologize. Sarah, if you could scroll back to education and outreach. One of the things under this section that is coming up that I wanted to be able to recognize is, even though it hasn't happened yet, so you'll see the report on the next meeting, but in a couple of weeks, Sherry has been invited to be a presenter to the state of Louisiana on a number of topics. So I wanted to give the opportunity for Sherry to brief the board on what she's been asked to do.
Oh, thanks, Michelle. So I presented at this same conference last year. Basically, the Louisiana board puts on a 2-day conference for free for any licensee in Louisiana, and they talk about various different topics, and they usually have an entire day devoted to boundaries, professionalism, communication, things like that. So I've been invited to come present with some other people. And one of the things that we're doing, or that I'm doing, is we're going to do some highlight out some videos of people who have been through disciplinary actions with boards and sort of their experience with dealing with board and going through trainings and things like that. So I'm really excited to be able to put that material together, which will then be available to us to use in the future after that conference.
Sherry, is that offered virtually and in person, or just the whole conference? Is it just in
It's only in person, yeah.
Okay.
And it is a great opportunity to kind of twofold, I think, to both the honor of Sherry being invited to be a key presenter for another state PT board, and I think also helpful to be able to bring back information from another conference to be able to share with the board And the development of materials, of course, is something that can be integrated into the kinds of presentations that we do for schools and for other licensees. I think the other piece is for those that were able to attend the annual meeting in the presentation about the continuing education model opportunity that Louisiana is now going to be doing in their second year. It will allow Sherry to bring back more information about sort of the operational logistics of how that goes, how it's going, and be able to brief the board in March. So wanted
Yeah,
to
I think they're doing a few things differently this year than they did last year. So it'll be nice to kind of, after year two, be able to take a look and see what, what worked, what didn't work, and something we want to look towards in the future.
with those highlights, I will open it up if any of the board members had any questions on or corrections on the minutes or any questions on any of the other materials or financials. And if not, Madam Chair, then you would just need a motion.
All right. Looks like there are no comments or questions.
I move to approve the consent agenda items as written.
I second the motion.
Motion has been first and seconded. Roll call vote. Timothy,
Aye.
Aaron,
Aye.
Mariah,
Aye.
Sandra,
Aye.
Hoku,
Aye.
Susan,
Aye.
Erica,
Aye.
Dwight.
Aye.
Madam Chair, the motion carries unanimously.
Okay. Next item, public comments. Are there any members of the public who would like to comment at this point?
And if so, you can raise your hand and then we can make sure the Madam Chair, I'm not seeing any members of the public at this time indicate that they wish to make comment.
Okay, move on to the next item.
For the next section, this is typically the delegate reports for the PT Compact Commission and the Federation of State Boards of Physical Therapy. There are a couple of highlights here. I would turn it over to Aaron as the PTCC delegate for any additional comments or updates.
Yeah, we had our annual meeting, I believe it was December. Yeah, in December. And then so I was able to attend that as the Oregon delegate. And then I've been a part of the Compact Commission Compliance Committee, and I served my 2-year term, so I'll be retiring from that committee as of January 1st, this year, 2026. So I've already retired from that. But otherwise, I don't really have any updates other than what's written on Kansas and Nevada in January.
And just to clarify, that is Kansas, yes? Like,
Yeah. Apologies on the spelling.
It's a new state, didn't you know?
adding more and more to the compact there.
Yeah.
Yeah. Sarah, I think you might be muted on another.
Oh, I was going to say Michelle's computer died last night, so she gets a typo pass on that one.
Hopefully that's not my only typo pass, but thank you.
Thank you, Aaron. Thank you for serving on that committee.
Sorry, I was going to say, as the other committee represented here, my term also ended at the end of 2 years at the at the same time as Aaron's. So as of January 1st, I'm no longer on the education committee for the PTCC. But TBD if that remains, if they have difficulty recruiting. I've told them that I can serve an additional term. So just as an update there.
You. Right, other committee reports or?
I just wanted to add that I just got appointed to the resolution committee. So that's a 3-year appointment that
For the
began
for the
on-
Federation.
for the FSBBT, sorry. That began on January 1st.
Okay, thank you.
Hey, Sherry, this is Hoku. What does the resolution committee do?
You know, I just pulled it up because I knew you were
Okay.
going to. So the resolution committee receives and correlates motions and resolutions to be presented to the delegate assembly and identifies motions that fall outside the purpose of FSBBT. The committee provides advice and counsel to delegates regarding form, wording, and methods of presentation of matters to the delegate assembly. So my understanding is if there is a motion that may need, like, states don't agree, or there's people that have issues with whatever proposed motion might be, they work with the different delegates on resolutions of anything that might be an issue. I can't remember, I think it's been several years where there's been anything where there's been an issue, but I do remember a couple of times there's been some things where, I don't know, fees or something, where different states are on different pages about the motions.
Well, thanks for doing that. That sounds like potentially tedious work.
Thank you. Hope not.
No, just kidding.
And it is, you don't see resolutions very often from the membership. It does tie to, since the Federation is a membership-driven organization made up of the jurisdictional boards, if any member boards such as yourselves would like to see a modification to the bylaws or any of the policies, this is an opportunity for you to take it before the full delegation. So to do that, it's something that if there is something that as this board you're interested in moving forward as a resolution, then probably March is the best time to begin framing that up in order to get that to the resolutions committee and move that process forward. The other, I am in my 3rd year of my board of directors term for the Federation. And in that role, I am a liaison to the Continuing Competency Committee. And so we'll be able to provide updates in that role as well as the year moves forward. The only other item that I thought would be good to highlight is the upcoming regulatory training opportunity for board members. It's not just for new members to the board. If you've previously attended, you may attend. There is an offering in an in-person format. There's also an online format that you have the opportunity for. It is April 9th through the 11th. It is based on the East Coast. So if you're attending virtually, it does start relatively early, but it not quite as early as it is for those that attend from Alaska and Hawaii, at least. So I would encourage, if you're interested, to apply. They do prioritize from across the jurisdictions individuals who have not previously attended, but once they make sure they have capacity for that, they will fund individuals who have previously gone as well.
And I did get approved to go, so
Oh,
I will be going.
Michelle, can I add one more thing that's not listed?
Sure.
coming up in April, the 10th of 11th of April, we are hosting in Bend an NPTE. Well, the Federation is hosting an NPTE item writing workshop. They do regional item writing workshops all over the country, several during the year, and one or two they hold in Alexandria. But the last one that was done in Oregon was about 3 or 4 years ago. So I will be serving as one of the item writing coordinators. We've reached out to many licensees throughout the state. But if anyone on the board is interested in serving as an item writer, reach out to me. I can give you more information about it to put your name in. But it's a Friday, Saturday, all day. And then there is a commitment to write a certain number of items for the NPTE. Some get written during that weekend, and then several over the next couple of months after that. So I'm really excited. We did it last time. I would say that serving as an item writer was probably the most challenging thing I've done in my career, other than actually taking the exam, but also 100% the most rewarding. It is a lot of work, but really, really a neat thing to be involved in. So if anyone's interested, let me know.
Thank you, Sherry. Madam Chair, I don't have any other updates on that topic.
Okay, next item, please.
On this item, just you have a standing agenda item to make sure there's visibility into the strategic plan, the strategic focus for the board. And as noted in the last meeting, the focus for 2026, first quarter, of course, is renewals, since those happen every 2 years. And these other items that were previously identified, the rulemaking as a result of House Bill 3824 will go into mid-2027, significant body of work. And the other highlight on the compliance of website and materials, that work is initiated. Sarah, I believe the deadline on that is in April for compliance. Yes, on April, but we're beginning to review website materials to make sure that the board is compliant with those federal requirements. Any questions or other comments on this topic? Next slide, please. And of course, the other standing item for review in public session is the upcoming topics that you'd like to see come to the board. This is the current list added in the last meeting. The identified presentations from the annual meeting. There were a number of specific topics related to continuing competency and consent and similar issues. So we have flagged those and added those to the list. And we are working and looking ahead at your 2026 agendas on when to bring those items or speakers related to those items forward. Any questions or additions that you'd like to see for these items? Okay, not seeing any. Next item. The next item is an update on the Oregon Healthcare Workforce Survey fee increase. This was an agenda item that came before you at the November meeting based on the proposed doubling for the survey that the Oregon Health Authority administers. It is a statutory requirement for all PTs and PTAs upon renewal to complete the survey before the board is able to renew the license. The fee did go through the public comment process and was adopted by OHA. However, they've delayed the implementation date, which was originally January 1st. They've delayed it to July 1st, 2026. The impact on the board's licensees is that moves it past this current renewal period, which means for everyone who renews by the end of the renewal period, frankly, anybody that renews before July 1st, if there's a lapsed license renewal, they will have the old fee, and it's only after July 1st and this board's July 2028 renewal where licensees will need to pay that increased fee. So arguably good news for the board's licensees. Speaking of renewals, also a topic we wanted to loop back after your discussions at the November meeting. One of the key pieces was a proposed process change in how renewals are reviewed and approved. We framed up that in the last several renewal cycles, the board staff has done a continuing competence audit, and in the prior cycle, a full background verification audit prior to, in between when a renewal is submitted and before it is approved. Part of the drivers of that related to the new requirements out of the legislature relating to the pain management course being in every renewal, and the cultural competency course requirements also, which have both of those. The pain course is a specific course that must be taken, a singular course, and cultural competency, it could be multiple courses, but they have to meet specific criteria. Because those initially rolled out before a renewal period and it was new, board staff, your policy was to have us verify that and help folks come into compliance if they had not. We ran that again last time, and we were showing that folks were generally in the 2024 renewal, most folks, 92%, I believe it was, were using the right courses on submittal. And so we proposed a process change that would implement, and that if certain criteria would met, renewal could be automatically approved. And part of that was for the more than 90% of folks that did have all of the requirements met the first time, that they wouldn't have to wait for the manual process of approving that, and they could move forward with what they need with the renewed license. That was somewhat dependent on the ability of the vendor to make changes in a timely manner. They were able to do so. And Sarah, if you go to the next slide, please. So where we are, those modifications were complete and tested. We did hit the target of what I would describe as a soft launch January 5th, meaning the system was turned on, but we didn't promote that it was open. We did, of course, in late December, let folks know that it would open in January, but we hadn't given a specific date. And we let folks renew, which also helped us, before there was too much volume, make sure that everything was going to work as expected. And then we decided to move into hard launch, or announce that everything was open on January 9th. The one other piece that we implemented as far as a system and process improvement is the use of a email mailing list management tool. Previously, we've been doing that manually through Excel exports, and then through Outlook in individual batches, because you can't send too many at one time. and then managing the bounces and everything else manually. The new tool that the board is using, which is MailChimp, which was the bid, if you will, that was the most cost effective for the feature sets. It gives us much greater control over sending out messages, and it adds in some additional capability that licensees have been asking for, such as being able to post news briefs on the website, in addition to having that sent out via email. The other thing that it allows us to do is have much better information on how and if the emails are being received, if they're bouncing, and we also generally get some information related to whether they're being viewed. And when folks follow links, we can see what is popular or what is less popular. And so a particularly useful tool during renewals, when we want to make sure that we're getting the messaging about a license renewal being due out to the population. That allows us to subsequently target if we see folks where their email address fails or has gone to a junk folder, or they haven't opened it, it gives us some additional information to target those individuals to make sure that the messaging gets through. And will also allow us to fine tune in a much easier process for folks that have already renewed, to stop sending them the "hey, it's time to renew" messages, and just try to keep that sort of unnecessary messaging out of people's inboxes as well. Looking at renewals, when Sarah looked at the counts on Monday earlier this week, so these numbers they change every day. But at that point, you can see how many individuals have started the renewals and how many individuals have submitted as of that date. And of the 223 that submitted their renewals, 209 made it through that auto approval because they had submitted everything, was validated. And this talks a little bit about they didn't have any declarations, they were not paying by check, and they attested that they had completed all the required mandatory continuing competency. We are, even though these are auto approving per your direction, we are spot auditing weekly for completion of continuing competency, qualifying competency in particular. We do also plan on doing a percentage of submittals that will do a full audit, not just key pieces on that. And then the other audit piece that we typically do on the background, running a background verification, the plan is to do 100% of those that renew post the renewal process. So April, we would run all of that. Any kind of questions so far on this material? Sarah, did you want to add anything to either of those items?
I don't think so. I think the only thing I would say was that the reason for doing the background audit after renewal is that we can send it as one big batch. So it's less, staff time if we do it in April versus continually like we did last renewal or 2 renewals ago. But yep, that's the only comment I have there.
Thank you. Next slide, please. So in the preliminary audits of continuing competency, we are developing an issue in completion of qualifying courses, particularly in pain and cultural competency. This is not new. On the upside in context, based on numbers run yesterday, percentage of the total population, it's relatively small. It is a smaller percentage than it has been in past renewals, at least in this point. That percentage might change as more renewals are submitted. But it is still representing individuals that, even though they have submitted and attested to their renewal application being complete with qualifying courses, they are not in fact the correct courses. So for some context on that, we have some screenshots on the renewal application. So next slide. And this one might be worth, if you can expand the screen to kind of drill into the text there. In the online renewal process, this is the first place where the page by page, the application, in this case, is identifying, please review these requirements below. The first requirement is you are required to complete the OPM, the pain management module that is offered by OPMC. This is required for completion and cannot be substituted for any other pain management course. It then talks about the cultural competency course that meets the criteria and a few other items. So that's the first information that's provided to the renewal applicants. Next slide. Then here they will, there's some information about the categories and the number of credits that are required on this screen to give them a little more information, and possible to scroll down just a little bit, Sarah, on that page. And I do apologize, it's a little hard to see, but you can see the some of the categories or some of the courses that you can begin to add there. Next slide. Then we have a number of certifying statements that applicants are requested to certify before they submit the renewal. And the first one is attesting that they've met the minimum continuing competency requirements, including the specific OPMC pain management module and the cultural competency with a reference to those OHA requirements. Next slide. So that's just background on context, that the individuals who have not submitted the correct course, this is the in addition to the information that's gone out in news briefs and is on the website, in the application itself as they go screen by screen, this is how the board is communicating that there is a specific requirement and a specific course. But even still, we have individuals that are not submitting the correct course. They're submitting a pain course, but it is not the specific pain course that's been required. I'll pause there for a moment. Any kind of questions or thoughts on that background? Okay.
I do sorry, I want to give just a little bit of context to that 1%. The way that those were identified was purely by the name that they wrote down for the course, right? So there's a good chance that there's a slightly higher amount that we would find on auditing ones that they put in a somewhat generic name. A lot of people put in like pain management module, right? I don't necessarily know if they're understanding that that's a specific pain management module versus, you know, I've had other ones that I've seen that are like pain management in children. That one's very obviously not the right one. So that number just includes the ones that are very obvious.
And there's no way to do it like the workforce data, like you can't move forward but because it's a state, like you can't just say.
So they can't move forward without providing an upload and saying that they did it and choosing one that fits in that category. The issue is that they're just putting in something completely different, right? Like we don't really have a way of controlling what document they upload. So they could be uploading, you know, a picture of their driver's license. They could upload any sort of image, and barring a completely different software system, we don't really have a way to force them into uploading the document that we want.
I was just thinking because the pain management, there's only one, right? You have
Yep.
to do that one. It's a state one, and there's no option. But
Yeah, and I'll say that the number that we've seen has decreased year over year as we've done this. So I'm pretty optimistic about that 1% number because I think last time, like Michelle said, it was about 8%. But that being said, we still do need to do something with this 1% who we know are, you know, not meeting the requirement. Doesn't mean that it's a bad class that they took. It just means that it's not the class that the legislature requires.
Can I just,
And it is,
go ahead.
yeah, please.
I was just going to clarify to Susan's point. So when they are listing that in their list of continuing competency, there is only one category that they can select for the OPMC, and it does say like OPMC pain management module. If they don't select that category, then they can't progress any further in their renewal.
Yeah, if they haven't uploaded at least one CC to that. And we do accept either 1 or 1.5 because they changed the course about a year ago, and we'll still accept the older course if it was taken within this renewal period. So it, you know, it counts towards their total 24 hours. And we do have to, because of the 2 courses, we do have to kind of let them free type the name of their course in there.
And this was because the percentage of folks each renewal that are utilizing the wrong course has been going down. That was the threshold in the procedure change because we used to review that before approving the application manually. But that means that everybody had to go through that manual review of their courses, and the vast majority of licensees didn't have an issue. So it didn't, part of the shift this time is setting things up for that auto approval if certain criteria is met. That is why, as part of that, to make that go forward, folks are being asked to attest to having completed that specific course. And so they are needing to not only get the right category and review those pages and upload it, but they're also on that final page needing to attest that it is in fact that specific course that has been uploaded. If they don't attest to that, then it will not automatically approve.
They actually can't even get past this page unless they check this box. Oh, sorry.
And so I guess what happens so in April, you're sending in background checks? Is that what you're saying?
Mm-hmm.
And so by that time, people are practicing on their renewed license. And if stuff comes back
So that's
yeah. Sorry, go ahead,
for,
Michelle.
That's for background checks, but this ties into the weekly audits that we're already starting to do, and reach out to them. And I actually I have a couple of other slides that I think will address the question that you're framing on that, if it's okay to move to those and then come back to the question.
Mm-hmm. Yes, please.
Okay. Sarah, if you scroll you currently have delegation to us to review, approve, and issue a renewal license for PTs and PTAs. You end up doing a ratification on those processes. In our weekly review and triage, as we identify these issues, we are wanting to follow up with folks to present an opportunity for them to correct the issues. It's part of what we want to talk to you today about, what approach or what policy you would like to see moving forward. My recommendation, you could take a number of different approaches. The individuals who have submitted and attested to having completed the application, there is a rule that requires that they complete all necessary continuing competence prior to submitting their renewal. And so by the letter of the rule, those individuals are arguably in violation of the rules. At the same time, it's sort of a liminal in between times because the renewal period is still open. And in the past, the board's policy has been allowing folks that had submitted something that wasn't qualified to be able to correct that before the end of the renewal period, and if they did so, to move forward. So framing up under the delegation, under part 7 that's on the screen here, the black language is what it currently says. To perform random continuing competency audits and background verification audits on license renewals. What staff are proposing that you consider is adding language and issue advisory letters or initiate investigations consistent with board policy. I'm going to skip 15 for now. And if you could go to the next slide, Sarah. I wanted to give you an example of what that would mean. This is your policy on compact privilege purchase requirements review policy. Pop back one, Sarah. This language in part 7, and issue advisory letters or initiate investigations consistent with board policy. That language is, there's parallel language for that relates to the purchase of compact privileges and meeting of those requirements for that. So next slide. This is what that parallel policy would be. And essentially what you determined is that in this case, when the board receives notice of a purchase of an Oregon compact privilege, that board staff will verify the completion of those purchase requirements. And then you set some thresholds that if the individual completes the ORJAM, the jurisprudence exam module, within a certain number of hours of being notified of the failure to do so, and prior to practicing in Oregon, basically, if they do everything that they need to do, board staff can issue a confidential advisory letter, and that those letters are reported for you to review and ratify. And if they're non-responsive, don't complete the requirements, had already practiced that, or had received a prior advisory letter on the same issue, then an investigation is initiated and brought to you. So for compact privilege purchases and review and staff delegation, that's the policy that you set up behind the scenes of what you wanted staff to be able to do independently and what you wanted brought to you as far as an investigation. So in that context, what we're also proposing for your consideration, if you were to want to enact the proposed delegation language about issuing COWs and initiating investigations on the next slide, is a draft of what that could look like. In this case, when board staff performs a continuing competency audit during renewals and determines deficiencies, if the individual submitted a non-qualifying pain or cultural competency course and the individual, after notification, completes and submits proof of completion with a certain number of days or by whatever you want to do there of qualifying courses, board staff may issue a confidential advisory letter. If the individual is not responsive, does not complete the requirements, or has previously received a confidential advisory letter pertaining to a prior renewal or for other audit issues, board staff will initiate an investigation to bring to the board. And then maybe language to the effect of, notwithstanding all of that, if there's simply a miscategorization, but everything was submitted, that can just be corrected with that without any other action. So the question before you is, with what we've shared about the process, with what we've conveyed about that there is at least an issue that we're identifying and have the opportunity to communicate to the licensees to take corrective action. Is that something that you're comfortable with delegating us to do? And then if so, what do you want the policy as far as those limits of what you authorize us to do? And in what limits and in what instances do you want it just to come to you? And I'll pause there.
Tim?
Yeah, I appreciate the hard work you've put into this, and it seems very clear and transparent of the process, and I'm in support of your staff proceeding with this recommendation.
And do you have a thought on how many days, like in that second paragraph, how many days?
14. I think 2 weeks is
You
plenty
said
of time.
14?
Yeah,
Sorry, just taking notes. Thank you.
I would even be okay with 7. I mean, it should be fairly quick and easy for them to find that and proceed with it. Thank you.
Anyone else have thoughts on?
I just have a thought, this is Sherry, of may issue a confidential advisory letter versus will. Like, is the thought that there would be a time where there isn't one issued if it falls in that category?
It's a good question. I think it's up to the board that if you say will, then if that situation happens where they've submitted, then there will be a confidential advisory letter issued. If you want board staff to have a little more discretion on determining if, for example, let's say that an individual took it but didn't upload it at all. So it's not that they misclassified it, but they took it, forgot about it, put in another paying course, but had already taken it and could just upload it and submit it. Then would that be a situation that you would be comfortable with board staff having discretion not to issue a confidential advisory letter?
I'm just making sure we don't need like a sub policy to the policy, of if these are the things, no.
Yep.
Oku?
Sorry, lower my hand. Okay. Thank you for this. I'm good with delegation. Just had a question about the timing so that the licensees responding time. Do we have information on how long other boards usually allow for that response?
To my knowledge, and this is just based on conversations, I haven't done a formal survey of their health professional boards. I'm not aware of another board that during the renewal process checks and verifies it and has sort of the same kind of grace period that this board has had.
Oh, I see.
Some boards only have an attestation. I believe medical board is one of those where they submit that, and then if they do an audit, then there's an investigation.
Okay, thanks.
And I'll, if it's okay, I would, Joanna, who does work with other boards, are you aware of any additional information there?
No, same thing. It is all anecdotal, of course, from what I've seen, but my experience is the same as what Michelle was saying, that most boards find these things out on an audit after the fact. And then they have sort of a variety of ways of dealing with this. So this is, I mean, very customer friendly on your part. Let's put it that way.
Got it. Okay, thanks for that. Then I'm with Tim, like a short time frame, since it's already sort of outside the bounds of like what usually happens. So a tight turnaround is good for me.
I feel like 2 weeks is a little too long, but just because it's like these classes are so short. Again, we're giving you the grace of like giving you time to do it, but then we have to wait 2 weeks to like finish the process. I don't know. I am kind of with Tim of saying more like 7 days. Like then they have a weekend, to get through it, but they're all short courses. You can do them online.
But this is still within, they're not late yet at this point. So,
Correct.
correct? So
They're not late. There are two issues of potential violation. One, they attested that they did complete the specific course on the submittal. And the second piece is there is a rule that requires that all of the necessary continuing competence is completed before submitting it.
before you push
before you finish. So you do, and that's part of why with these individuals are arguably in violation of both of those issues. But at the same time, it's this in-between times where it is still part of the certification period. So there's an opportunity for corrective action if the board wants to take this point. The other approach you could take is kind of to Joanna's point, you could just open investigations or instruct us not to audit anything until after the renewal period. This is really framed up in a way to help people be successful now.
But it almost seems as if you audited after the period, it would be the same thing, right? It would still be like the same advisor, the same parameters of you listed the wrong course and you have this much time to do it and you get an advisory letter. Just a different, I guess I'm thinking there's people who are not going to renew until March 30th or 31st. And so by the time they get notified, it will be after the fact because they won't have time to do it. Their 7 days will be after renewal because there's going to be a lot of people that fall in that category.
Yeah, but those people will also potentially be practicing without a license, which is
but their license will have been automatically renewed. I renew today or I renew on March 30th. It's going to be the same thing, but I'm going to that person will run out of time. You know what I mean? It'll go into April.
And I
think everyone has the same renewal period. So where they choose to renew within that 3 months is up to them. My only thought with the idea of 7 versus 14 days is that I think that it would be reasonable if you guys would like a short turnaround time. And this maybe gets into some things that Michelle was also going to talk about with delegated authority is, we could set it as 7 days. And you guys could give us the leeway that if someone has extenuating circumstances, it can be extended, right? I'm thinking, I'm actually going to be out of the country for a month and I won't have access to internet, that sort of thing. Yeah, maybe you do need more than 7 days. And maybe you rushed to get through your renewal because you knew you were about to leave the country. So that's maybe another option that you could set it as 7, but also give us the leeway to extend it up to X.
What would
for extenuating circumstances?
What would be easiest for the staff? I mean, we're thinking a short turnaround. I think my guess is a short turnaround time seems like that's most helpful to you, but monitoring that's another problem too. So maybe we want a 30-day or prior to, I don't know. I mean, it needs to be done if they're in that. I would think the deadline is our real deadline for sure. If you're catching it in between times.
I think
you're trying to be proactive and user friendly, which I love.
I would stick with a fixed number. I appreciate what Sarah is proposing with individuals, and as someone who's clearly recovering from the flu, I would be inclined to 14 days because
Yeah.
um,
Illnesses, surgeries, family.
yeah,
Yeah.
I think it particularly sometimes folks don't necessarily have a weekend, but they might, with over 2 weeks, have at least one weekend in there or some time off. And the other piece is, let's say they do it on day 15. All that happens in that point, if they've gone over, if you make it 14 days, for example, that exceeds our authority to issue a confidential advisory letter. So that would mean it comes to you. You can still take whatever action you wish, but that's the trigger, is that it comes to you instead of being handled by us.
And
so it's
do they have I mean, does that put their license on hold, or like they get
no,
and
No,
I
they
guess
have their license.
they
right.
have their license.
License automatically.
So
Yep.
It's gonna be a little bit different because, yeah.
but it comes to I mean, so it would come in the next board meeting, and we would have decisions to make about whether or not they had a violation. That I guess on that same note, the more that I read the third paragraph, the less sense it is making at that sort of that last part of it. So if they don't respond, this would be the person who doesn't complete those requirements, previously received a confidential advisory letter pertaining to prior renewal, or I guess it's so if they've ever gotten a confidential advisory letter for anything, or just
Pertaining to a renewal.
all right, so it could have been anything within that renewal.
Yeah, that if there's and it's sort of a conservative approach to minimize what you're actually delegating to staff, and that the only difference is that means that individual case, if they had received an advisory letter pertaining to a renewal, that we don't have the authority to make the decision about the corrective action in a confidential advisory letter. That would just come to you for your decision and determination about the specifics of that. And the last phrase, or for other audit issues, what that is for is that if it's not something specifically related to the second paragraph, meaning the submittal of a non-qualifying pain or cultural competency course. So for example, everything from they submitted other clinical courses, but on audit was determined that it wasn't, it was outside the certification period. They didn't, it wasn't what they said it was, things of that sort, up to misrepresentation, that those go to you. So this is really trying to carve out just this very specific delegation on that. The other thing, arguably, it does for other audit issues is that this is the period while we're still in open renewals. Since you have a March meeting, what I would recommend is we report out on the data of how it's been going, how many renewals are still open in March, because I would ask you to consider whether you want us to have the authority here that extends past March 31st, or if all of those will just be brought to you. I don't think you need to make that decision now, kind of to Sherry's point. If somebody renews and doesn't have it correct on March 30th, then the way this is written, I would bring it back to you. because it's not clear. But I don't think you have to make that level of decision today.
Okay, thank you. So it's preferred, we're looking at moving forward with this with the completion within 14 days. Is that sort of the intent?
Just to throw one more thing in there, is the 14 days, like, how are we notifying them? Email or mail? Because 14 days from what? Just so we're clear.
For the PT compact purchases, that initial notification is via email because they're required to have an email on with the board. If that bounced and we couldn't get a hold of them another way, and they arguably hadn't gotten that, then it would start, if we had to send them a certified letter, it would start from when they received the certified letter.
14 days starts after notification, and that's it.
Correct. Yeah.
However that occurs.
Yep. And procedurally, we would meet as staff to talk about, could that come from any of us? Would we filter it all through one? How would we track that? We would work out those mechanisms.
Yeah, because I could see people saying, well, I didn't see the email for 7 days. I didn't open my email until however many days after you sent it.
Yep. But generally, like in the other case, the notification is based on when we send the communication to them, to their presumably valid contact information on file with the board, which they would have just reviewed as part of the renewal process.
Right.
So do we need to do delegated authority today then?
Yeah, if the board would like to explore this, then you would need at least one motion. I do want to ask for one more consideration related to the board's delegation before you consider making a motion, however, if that's okay.
Okay.
Sarah, can you move back a couple of slides to the draft delegation here? Our other request to you is to consider a modification to line 15. In November, you added the ability for staff to grant extensions to complete continuing competency. The rule, as you recall, also has the ability to request a waiver, and you had decided that staff could delegate review and granting of extensions, but any request for a full waiver would come to the board. At that time, you had limited the staff's ability to grant an extension up to 90 days. What I would ask the board to consider is removing that limitation. And the reason for that is if we were to, most of the time an extension is going to be related to typically medical or other qualifying events, sometimes military deployment, but usually situations where I think 90 days could arguably be too short for some individuals based on circumstances they may have. And it kind of depends on the person, their personal situation, health condition, and in some instances, there may even be an individual who they're renewing their license, but they're still essentially out on medical leave and not able to then take the courses, or they're not practicing anyway, but they're maintaining their license. So that's some background on why I'm asking for this particular edit to the delegation authority. the consequence of making this change is that you leave the discretion of granting extensions and for how long up to board staff. But I think that would give us more flexibility. The alternative is that every request from these individuals with their specific personal information would need to come to you in public session. Mariah, I think.
How often do you get requests like this?
We tend to get, I want to say under 5 per renewal period. I see Gayla confirming that.
That's exactly what I was going to say, Michelle, under 5.
Okay. It is not many, but it's usually very complex situations.
What has been the longest extension that you've had to work with?
For an extension, I think the longest that we've had in the past was a year, maybe a little bit over a year. And it did have some of those variables where they had not been practicing due to a health condition for a period of time. And in some instances, that was expected to continue before they would be able to return to taking courses and then returning to practice. And I think the other perspective is that it gives them a little more time to complete the continuing competence, renew their license. It does not in any way reduce the required continuing competency in the next certification period, right? So even though they might be taking it in May or July, in the next, it still counts back to this renewal. It doesn't lower what they'll have to complete in the next term.
Any questions, comments?
I don't think I have any questions. The only thing that like makes me think twice sometimes about these is like, should there be a nefarious executive staff or board staff moving forward? Like, how could that be like used incorrectly?
It's an excellent concern, Hoku. I think one of the reasons that we make sure you review the delegation of authority letter at a minimum every year is so that you get to change your mind. You can modify the delegation of authority every public meeting that you want to. And so if there were indications that you wanted to pull back this or any other delegation to staff, you have the authority to do so.
Thank you for that reminder. In that case, I am 2 thumbs up.
Okay. So would we need a motion to move forward with this? Oh, Tim, you have your hand up?
I was just going to comment on Hoku's comment. I mean, sometimes, I mean, we have a very, not trying to say senior, but very qualified executive team. And so that allows us to provide delegated authority. Yet in the case of succession, with a newer staff supporting us, then you may want to actually bring it back closer to the board. So it can be adjusted, not even if it's nefarious.
And so to, like Michelle, like you were saying, if there were turnover in the staff, that could prompt us to say, well, with this turnover, we want to review right now the delegated authority.
Yeah. I think I would also, for maximum transparency, if you move forward with this, I would also, doesn't have to be in the motion, but on the record, I would direct us to list at least the number of extensions that are being granted during the renewal period in the director's report, for example.
Yeah, that would be a great item to have, like those extensions and in the, I mean, I would say to sort of paragraph 7, like how many of those advisory letters kind of went out.
Absolutely. Any advisory letters issued, those are assigned case numbers in order to process the confidential advisory letter. It would be issued, but that would come before you to vote to ratify any administrative actions.
And I just wanted to add with the extensions, there is a rule that says that people can have an extension. So this is just that the rule already exists. This is just delegating to the staff to be able to tell them they have the extension versus bringing it back to the board to give them the extension.
Yeah, and that was when you considered this in November, those rules were part of that packet. So, Madam Chair, as far as, because we've presented you with a lot of different materials, for motions, at a minimum, we would need a motion to modify the delegated authority as discussed. We would also need a motion to adopt the policy again as discussed. I think would work for a motion. I think that you could, if the board was interested in doing all of that was discussed, I think that could be done as a single motion. But you could also break it out into a motion related to the change in Part 7, a motion related to 15, and then a motion related to the policy at your discretion.
I mean, so they are connected, the two.
Yeah. And you could, one thing you could do is you could offer it up as a singular motion, and then if that motion doesn't pass in discussion, somebody could propose a different motion to break it into smaller pieces.
Okay. Entertain a single motion at this point.
I move to modify the delegated authority as discussed. Do I need more than that? The renewals delegation authority as discussed.
Yep. And then if you also want to include in the same motion adopting the related policy as discussed, you could add that to the motion.
Say that again.
If you wanted to throw in the adoption of the policy into the same motion, then I would recommend adopting the changes to the delegation of authority letter as discussed, and adopting the related policy as discussed.
I move to modify the delegated authority as discussed and adoption of the related policy as discussed.
I second the motion.
Pardon me. The motion has been first and seconded. Roll call vote. Timothy?
Aye.
Aaron?
Aye.
Mariah?
Aye.
Sandra?
Aye.
Hoku?
Aye.
Susan?
Aye.
Erica?
Aye.
Dwight? Dwight, can you say that one more time?
Aye.
Excellent. Madam Chair, motion carries unanimously. And thank you. Okay to keep going? Okay. The next order.
Yeah, just everybody's okay to move forward. I didn't see.
Okay. The next order of business relates to administrative rulemaking. This item was brought to you for initiating the administrative rulemaking process at your last meeting. The rules were published and distributed to interested parties and licensees. During the public comment period and hearing, no comments on the proposed rule modification were received. There was a clarifying question, just seeking more information about what a compact privilege was and how it worked relative to the Oregon license itself. So with that before you today would be adopting your proposed rule amendment. With this one, I would recommend an effective date of February 1st, just to allow some time to communicate with the PT Compact Commission, because they're the ones that need to change their system to change the fee. But happy to answer any questions.
I think we discussed that before. Anyone? We can move forward with a motion, if anyone.
I move to adopt the proposed amendment to Oregon Administrative Rule 848-005-2-0020 little h as written, with an effective date of February 1st, 2026.
I second the motion.
Motion is first and seconded. Roll call vote. Timothy?
Aye.
Erin?
Aye.
Mariah?
I
Sandra?
Aye.
Hoku?
Aye.
Susan?
Aye.
Erica?
Aye.
Dwight?
Aye.
Madam Chair, motion carries unanimously. The next item also relates to proposed rulemaking. In this case, the board had reviewed the proposed rules that were published by the PT Compact Commission at your November meeting, in part to determine if you had any public comment to present the PTTC board. And those rules were subsequently adopted at their early December meeting. Because there weren't any substantive changes to the rules or any issues identified by the board, what we did as soon as their vote was final was, under the delegated authority, which is listed on the slide, you allow staff to initiate the public rulemaking process to keep the process moving. We did that, sent out the notice of proposed rulemaking, public comment period, and hearing were established, and there were no comments or questions on this proposed rule amendment to adopt the most recent PT Compact Commission rules. So unless there are any questions, then you would just need a motion to adopt those. I would recommend making those effective February 1st as well, just for ease of communication.
Okay.
Ms. Reynolds, are you ready for a motion?
I am ready for a motion.
I move to adopt the proposed amendments to Oregon Administrative Rule 848-055-0001 as written, with an effective date of February 1st, 2026.
I second the motion.
Motion's been first and seconded. Roll call vote. Timothy?
Aye.
Erin?
Aye.
Mariah?
I
Sandra?
Aye.
Hoku?
Aye.
Susan,
Aye.
Erica,
Aye.
Dwight,
Aye.
Madam Chair, the motion carries unanimously.
Okay. Next.
The next item is a brief update on, I know it feels like we were just in a legislative session, in part because we were just in a legislative session. But short session, which is every other year, is due to begin shortly. Because of your meeting cycles, the session is essentially going to happen and end before your next scheduled meeting. Sarah, if you can go to the next slide, please. This is the session calendar. Little hard to see, but in the green are the primary 2026 session. So you can see it opens and closes in effectively 6 weeks. Sine die is expected no longer than March 15th. It's March. And the red boxes are essentially key deadlines for first chamber and second chamber. Some of the legislative concepts are being introduced in legislative days that are occurring right now. Not necessarily with drafts of what the bills are going to be. So we're in this period where we don't really know what the bills are going to be yet. At your November session, you did have a presenter who came and talked about one bill related to the psilocybin program and dual licensure that they're expecting to be introduced. But bill drop is essentially happening tomorrow. So I wanted to flag this because we don't know much detail about what might be before the legislature that impacts this board. And we don't know if there may be something, a bill that this board would want to at least discuss or potentially work with the governor's office to provide testimony on. So depending on what drops, if there is anything substantive as far as impact on the board, I would recommend that we reach out to you about scheduling a special session to discuss those bills. Yeah. Otherwise, at a minimum, what we would be able to do is at your March meeting, let you know what happens and what bills will be impacting the board at that time. In theory, short session is supposed to be tied to budget and sort of corrective actions for prior legislation. It's not generally supposed to introduce any new policy bills. However, in just about every short session since they created them, there have been policy bills that move forward. I'm happy to answer any questions about the schedule or what we know of so far. To that end, although I have not seen any drafts, I've heard that there are concepts, not just the psilocybin one. I've heard that there is a concept that is going to, in some way, look at semi-independent agencies, which of course this board is one of, that might make some statutory changes to how semi-boards work. And I'm also expecting to see a number of bills related to public meetings law and public rulemaking processes. But that's all I am aware of at this time. Any questions or directions for us? Okay. I guess the final reminder, of course, is as public officials that there may well be legislation that is important to you as individuals. And you absolutely have the right to testify and provide public testimony on any bill whatsoever. If you are testifying on a bill, please make clear in your testimony that you are not representing the board, but only your individual interests or perspective. If it is a bill that could arguably be related to the board's oversight, then the second request would be let us know so we can let the governor's office know. So if you're making it clear that you're testifying as an individual, that you're not representing the board, and if you let us know if it's somehow related to healthcare in that way, we can make sure the governor's office knows, and that it can't be construed as an official position by the agency. But please be involved. Anything else on that? Nope. That is the end of what we have for the formal agenda for you today, unless any other members have other business related to prior noticed items, or things that you want to see brought to future agendas, or just general announcements.
Not seeing any hands up.
In that case, on the next slide, just a note that the next scheduled board meeting is in March, and the link here on the screen, the board maintains the full calendar for board meetings on the meetings and minutes page of the website. Other than that, Madam Chair, I turn it back to you.
Okay. The time is 10:09, and this meeting of the Oregon Board of Physical Therapy is adjourned.